You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the US and beyond. Hosted by Pari and Eve, public health professionals by day and content creators by passion, we bring you expert insights and actionable strategies to push the fight for equality forward in today's America. On this episode of Women in America, pediatrician and US candidate for Senate, Dr. Annie Andrews, joins us to chat about healthcare and her race against Lindsey Graham. Let's dive in. Annie Andrews, thank you for being here today. This is pretty exciting. It's not often that I get to speak with somebody that's at head-to-head in a congressional race.
I'm happy to be here. Thank you for having me.
Yeah, thank you for taking the time. I'm sure things are busy in South Carolina. Tell me a little bit about it's been like on the campaign trail.
Yeah, it's been a whirlwind of 4+ months. I think I decided to get in the race about 6 months ago. It feels like it's been 2 weeks and also 6 years.
What is time even?
What is time? That's a great question. I'm still a practicing pediatrician and, a candidate for the U.S. Senate in South Carolina and a mom of 3 school-age kids.
Wow.
So it has truly been a whirlwind. But every time I'm out on the campaign trail, every time I walk into a room full of motivated, frustrated but motivated, fearful but optimistic folks who are looking for change in South Carolina and in this country, I leave feeling so energized. So people keep asking me how I'm juggling all these things, and it's because of the energy I'm getting from my supporters out on the campaign trail. And, it's really a make or break moment for us as a country. South Carolina is an important part of that equation. And I just feel so motivated as a practicing physician to use my platform to push back against this, coordinated attack we're seeing on our nation's healthcare system and all this distrust that is growing within our public health system.
Yeah. So to contextualize for folks, you're running against Lindsey Graham. Is that right?
That's right. I'm running against 22-year incumbent Republican Senator Lindsey Graham in South Carolina.
Yeah. You're running against someone who I continually am confused about why still exists in Congress. And so, right off the bat, there's something to root for there. But tell me why, you decided to run, especially in, the fact that he's been there for 22 years. There's obviously, long-standing, deep Republican roots. And I think the MAGA movement has also taken hold of several parts of South Carolina. So what is it that kind of pushed you from, just your doctor's chair into now potentially Congress?
Yeah, it's not a path I ever envisioned for myself, which I think is important for people to hear because, the moment is calling us all to do new things, to be brave, to step into spaces where we don't necessarily feel inherently comfortable. And we have to take those challenges head on because our country needs us, especially as healthcare providers. So I never planned to get into politics. I've worked in children's hospitals as a pediatrician for about 2 decades now. And it really was what I saw for those first 15 years that got me off the sidelines first into advocacy, and then understanding that if we want to advocate for policies that are beneficial to America's kids and families, we have to go upstream further and engage in politics to elect the right kind of leaders who actually care about solving these problems. So once I started to understand how healthcare is related to advocacy, how advocacy is related to politics, it became really clear to me that the political space was going to be a space for me. So, at children's hospitals, I take care of kids who are struggling with food insecurity. They don't know where their next meal is coming from. I take care of kids with chronic diseases like asthma and diabetes, and their parents aren't sure if they can afford their insulin or their albuterol inhalers, kids who are struggling with mental health crises and can't find mental health resources, kids who spend the night in the hospital room alone, which is always so heartbreaking, but their parents are juggling multiple jobs just to put food on the table. And then, like every other pediatrician in this country, I've taken care of children with bullet holes in them. And so that is what drove me to get off the sidelines, initially in advocacy with a strong focus in gun violence prevention advocacy as a member and a leader within Moms Demand Action. And then as the further I got into it, the more I realized politics was the answer. And so I ran for Congress back in 2022 against Nancy Mace. Did not win that race, but importantly, I didn't go away. I've been fighting the same battles for kids and families in South Carolina every day since. And now I'm running against Lindsey Graham for the U.S. Senate because we need more healthcare providers in office at all levels, and deeply entrenched, career corrupt politicians like Lindsey Graham are doing nothing to benefit the people in my home state of South Carolina.
Yeah, I'm just thinking about how in normal times would be a totally straightforward concept, but right now it seems revolutionary to have people with actual qualifications at the helm of Congress, right? Like, imagine actual pediatricians making decisions about children as opposed to RFK Jr. It would be amazing. What has made you hopeful in terms of like what you're seeing in the zeitgeist, the culture? Are people sort of resonating with what you're talking about? Are they starting to see that there's something that needs to shift?
Yes, I believe they are. I think it's important for folks who aren't from South Carolina, who maybe live in a nice, pretty, comfortable blue state, to understand that South Carolina is not like 80% Republican. It's like 55% on a good day Republican, 45% Democrat. So we can flip seats in states like South Carolina if we have the right kind of candidate. And, I'm so encouraged when I'm out on the campaign trail because I'm showing up in rooms in rural South Carolina, Oconee County, South Carolina, Georgetown County, Sumter County, Florence County, rooms full of people, standing room only, people who are excited to have something to be excited about, optimistic about what is possible, understanding that Lindsey Graham is not the same senator he was 22 years ago when he was first elected. He is a follower, not a leader. And he used to, in his early career, follow people like John McCain. Unfortunately, now for us, he's following Donald Trump. And so even, people who have traditionally voted Republican in the state of South Carolina, they're starting to understand that Lindsey Graham is not fighting for them. He's in D.C. to keep one man happy, and that man is Donald Trump. He has abandoned us down in South Carolina. And so people are considering other options. And, I'm not a career politician. I don't want to be a career politician. I see politics as a path to solve those problems I saw every day at the Children's Hospital where I worked in the Low Country. And I just want to get up there and solve some problems, serve a couple terms, and then get back to my job as a pediatrician that I love. And I think in this moment where RFK Jr. is getting headline after headline and really destroying our nation's healthcare system and our nation's public health system, like, people understand the need to have folks with a serious professional background, with serious expertise on these issues in office. And so that's, we're going to break through and we're going to shock the nation in November 2026 when I defeat a 22-year incumbent senator.
Absolutely. I do want to go back to something you were saying initially when you were speaking, is that, Lindsey Graham used to follow the likes of John McCain. And something we often share on our platform that I think people are maybe starting to understand is that the Republican Party of old no longer exists, right? The Republican Party of new is not even really a party anymore. It is simply like there's an authoritarian leader and everyone else is just sort of falling in line. And the Democrats have been attempting in, I think, a few different ways to sort of push back and fight back within the realms and confines of like what's allowed within the system. But, as someone on the outside, like, I'm not running for Congress, so you definitely have some insight that I don't. But I often find that even on the days, like, I advocate online every day and I'm rooting for folks like you who are like thinking about things differently and in the ways that need to be. And I would sort of love to hear from you, just like, honestly, you're like very like real, like mom, woman, doctor take on why you chose to run as a Democrat. Because, I'm hearing from a lot of young folks, and even sometimes, I'll be honest, like even though I root for them on the daily, sometimes I'm like, wait, why are we, as in the royal we for Democrats, continuing to play a game in which our enemy has like exited, the battlefield? Like, they're playing a completely different. In fact, they're not even playing a game. They're just like exacting some sort of war. But basically, what I'm trying to say is, tell me what you think like you're able to sort of bring to the Democrats, what new energy you might be able to inject to a party that honestly needs some.
Yes, I thank you for this question because, you're totally right. The Republican Party is not the Republican Party of my dad, of my grandfather. That party has left the center right. And so I'm not asking voters to leave their party. I'm asking them to vote for me because their party has left them. And the only way to get a reasonable Republican Party back is for them to start losing elections over there on the far right. And as soon as they do, they're going to kick out all the crazy MAGA folks in the party. They'll pivot back to the center right because they're interested in holding power and winning elections. But But I also have a lot of frustrations with the Democratic Party. I did not grow up as a super political person. I actually did grow up in a Republican household. And, I identified as a Democrat when I first got off the sidelines because I saw them fighting for America's kids and families. Like, as a party, we are on the right side of the policy issues. Our plan for healthcare is far superior to their non-existent plan. Our
Concepts of a plan.
Yes, the concepts of a plan. Like our support for things like an expanded and permanent child tax credit is an amazing policy solution that would lift millions of American children and families out of poverty. The Republicans oppose that. Our plan on common sense gun laws would protect kids and communities all across this country. Their plan leads to more deaths and injuries from firearms. So we have the right policy positions, but we don't have the right strategy, as evidenced by the fact that we keep losing elections that we should be winning. And what I'm learning, as a newbie to this space is that, just like everything, there's some deeply entrenched politicians and consultants here in Washington, D.C., that want to continue to play it safe and use the same old playbook. They want to elevate the same kind of candidates and, frankly, suppress candidates who are breaking through and making noise in this moment when we are desperate for new leaders. Like, we have lost the young people in this country. Last election, we lost a lot of young white men, young Black men. We have not made progress with white women like we should, yet we continue to enter every election cycle, propping up the same kind of candidate, using the same kind of playbook. And, as someone who used to be an outsider, it's exhausting. It's like we've got to try something different. I have the privilege because I'm running in a state like South Carolina where a lot of people would tell you they don't think I can win. I can tell you all the reasons why I know I can win. But so people right now aren't micromanaging my campaign. They're not telling me what kind of candidate I need to be, what kind of issues I need to weigh in on, how I should be communicating or where I should be communicating. And that gives me the freedom to just be who I am. And, I would never run if I couldn't have that freedom because I'm not going to sacrifice who I am, sacrifice my professional career, time with my children to just be some puppet for some master leader here in DC. And we just need more candidates who are willing to sort of step up to push back on the establishment. And, we're desperate for leaders who can resonate and break through to these voters who we need to start winning elections. So we have the right policies. We just don't have the right strategy. I feel optimistic about what's possible because of some of the candidates that are popping up around the country who have a different messaging style, who understand the moment and are willing to meet it.
How would you feel like your perspective of being in emergency rooms has sort of like prepared you for this moment? And I specifically asked that question with the lens of, we're seeing over and over again for anyone who's paying attention is that there's like a massive assault happening on healthcare. Mm-hmm. And that's at like levels that are obvious and levels that are subliminal as well, right? And the pushback also that is now happening on like what used to be objectively good healthcare policies is alarming. Like the Republicans are trying to dismantle the Affordable Care Act, even though their own constituents would be so deeply devastated by that ending, right? Like I was reading an analysis a couple of weeks ago that was saying that the average American's health insurance bill will increase by at a minimum of $700 starting Jan 1st of next year. But in some states, and I apologize, I don't know exactly what it is for South Carolina, you might, but in some states, it's actually closer to like $9,000 worth of an increase. And these are people that are on the ACA because they need healthcare access, right? And somehow Republicans have managed to sort of create a narrative that has like convinced people to vote against themselves. So, you're in ERs every day dealing with sick kids who, you're not saying this, I'm saying this, might actually be more mature than some of the people in Congress. But, I'm just curious, like you're on the front lines and are kind of seeing maybe the impacts already of all the things that they're talking about. So how do you feel like that is sort of like either, like preparing you or pushing you further into like what you want to do next?
It is, yeah, it is my aside from my own 3 children, it is my greatest motivator. I am on the front lines. I live in South Carolina, but I work part-time in Washington, D.C. And I was just on an overnight shift earlier this week. And, I'm a hospitalist and I go down to the emergency department to meet my new patients and to admit them. And so I'm walking, through the waiting room of a pediatric emergency department here in our nation's capital earlier this week. Every time I went down there, it was more and more crowded, more sick children, more worried parents. And these are families that cannot afford to spend another dime on healthcare than they're already spending. And what the Republicans what they have closed the government for, what they are advocating for is exactly what you just described, allowing these ACA tax subsidies to expire, which will double, triple insurance premiums for so many Americans. I understand it's 25 million Americans whose ACA tax subsidies will expire, doubling or tripling their premiums. 18 million of those live in states that voted for Donald Trump. So
Right.
your point is exactly right. These are folks who have been hoodwinked by the Republican Party. The Republican Party doesn't have a health care plan. They don't have a plan to address gun violence. They don't have any plans. They just are selling propaganda so that they can do the bidding of their billionaire donors and their corporate PACs and special interest groups. And I am hopeful that the pain that we are all feeling and we're going to feel, whether it's, grocery prices continuing to rise, our healthcare system continuing to be under assault, premiums rising, prescription drug prices rising, is going to wake some people up so they understand that they have been hoodwinked by the Republican Party and that the Democrats are out here fighting for them, which is why it's so important, going back to our point before, we need effective messengers who can clearly communicate on social media, in real life, on cable news, what it is the Democrats stand for. We have to clearly communicate it, and we also have to show some semblance of willing to fight. We have to throw sharp elbows. We cannot play nice. We cannot play by the old rules because, as you said, the Republicans have abandoned the rule book, and we're still here trying to over-explain things to the American people and say, well, like, gosh, golly gosh, darn it, we're right. Here's the data to show that we're right, and that's not breaking through. But I feel so privileged to still be able to practice as a pediatrician, to stand at the bedside of sick and injured children and their worried families and understand the struggles that they are going through. And, I think we don't talk enough about the impacts of these subsidies expiring because what's going to happen, because we don't have an insurance and individual mandate in this country, is people who are relatively healthy are going to see those premiums and drop their plans. They're not going to be able to afford it, so they're going to drop their plans. And if you understand how insurance works, that means that the healthier people are no longer going to be in the risk pools. So it's going to be sicker people. Those people's premiums are going to rise because their healthcare is more expensive. And, everyone is still going to get sick and injured, and they're going to show up in emergency departments. They're going to receive care. The hospital's not going to be able to compensate for that care. So it's just going to be this vicious cycle. And they are just actively destroying an already broken healthcare system. And our only chance to stop this is winning elections in November 2026.
Yeah, I mean, you absolutely nailed it. I think that sometimes the thing that gets lost in like the healthcare conversation for folks is like, well, if I'm not one of the 24 million or 25 million that's on the ACA, like this is not a problem, right? And like if you look at any system, like it doesn't even have to be a healthcare system. Like let's look at a grocery store. Like if there's like 50 extra people in a store than there were yesterday, everyone else's experience is also going to change. Whether or not that change is acceptable is like everyone else's prerogative. But like a rural hospital closing in, let's say, Georgia, like one random county in Georgia, actually affects what happens in the city of Atlanta, Georgia, because that means that there's a higher demand, right? And you said exactly that. But also, like healthcare systems in pretty much every developed country around the world are designed so that the society as a collective is propping each other up, right?
Yeah.
And like the president loves to call that communism, but he has like no understanding of what communism is, because what we're saying is like in a true democracy, in a society that cares for each other, that is invested in each other's like collective upliftment, which you have to be in order to do well as a country, you have to be able to prop up the most vulnerable, the most marginalized in your communities. And those are folks like the sick, the elderly, like orphaned children, sick children, those are all groups that the ACA in particular covers for, and are now those people are being turned into villains as if like they don't deserve to have basic human rights and access to healthcare. And even if I can't get through to the people on the empathy piece, I'm like, okay, if you don't want to care about them, fine. But exactly like you said, Annie, like, this actually affects you. This affects every one of us, right? Because a burden in one area has ripple effects on all of us. And, you were saying like emergency rooms are going to have to treat them. I actually like internally like prickled a little bit when you said that, because I was like, at the same time, though, Republicans are writing laws to make it so that emergency rooms no longer have to treat people, right? So I think we are very much like, I don't mean to be like, like sounding alarm bells unnecessarily, but I think that if we don't combat this, like, we are very much heading towards like a massive collapse of our health system. Mm-hmm. And like you said, the folks who are healthy or the folks who are young might not immediately feel it, but they will at some point, And so I guess all of that kind of brings me back to the reason why I was asking about your experiences as a pediatrician is because I sit here on the public health perspective, like you do more of the one-on-one work, and I'm like looking at it at a population level, and I'm seeing all these new policies come down about like RFK literally picking reasons out of the sky to identify reasons for autism. The Republican senators going on vacation while shutting down Congress, but still finding time to tell the FDA to get rid of mifepristone. Basically just like policy after policy to cripple people at every opportunity. And I'm curious about like, in South Carolina in particular, there's a bill that's been going through the state Congress for 3 years now where they're trying to rule abortion as a homicide. Mm-hmm. And ban all birth control. And unfortunately, states like South Carolina, Georgia, Texas, they kind of tend to be like the reproductive health playbook for the rest of the country. Yeah. And I'm curious, like, how have you thought about potentially approaching this with, like, as you mentioned, like communities that are still along the spectrum on like where they fall on these issues? And are you like using healthcare to get to these other pieces, or is it kind of all part and parcel of the same conversation for you when you're on the ground?
Yeah, I frame this conversation as medical freedom and an attack on women and a strategy to control women further. So you're right, South Carolina's state legislature is currently discussing what would be our nation's most extreme abortion ban. The bill that was discussed a couple weeks ago in our Senate Medical Affairs Committee is going to be up for discussion again sometime next month. And this is a bill that would ban abortion with no exceptions for rape, for incest, really treats abortion as homicide, criminalizes providers of abortion, so doctors in jail, women in jail, doesn't allow you to, help someone get to a different state where they need to seek their health care. It is truly draconian. And of course, there's only a handful of women in the entire South Carolina state legislature. And, these are rooms full of men who know nothing. They all know the difference. Just like RFK Jr., they don't know the difference between a placenta and a uterus. Yet here they are legislating what we can and can't do with our bodies. And when you have a discussion about criminalizing abortion, that stems from this concept of personhood, when Republicans try to say that personhood begins at the moment of fertilization. And what that does is also criminalize most forms of birth control and IVF. Yeah. So, as a Democrat, as a woman, as a physician campaigning in a state where this is what's happening in the state legislature, I use this to connect with women who maybe previously identified as members of the Republican Party, but they see what's coming. They see the access to IVF going away, access to birth control going away, access to emergency contraception going away. They hear these horror stories about women who are sent to jail, about women who are bleeding out in emergency department parking lots, doctors who are struggling with whether they should provide the life-saving care, knowing that it might send them to jail, hospital counsel who doesn't know how to tell doctors what to do do. And these folks have no business making any decisions about healthcare or what women do with their bodies. So I do think that, I was just meeting with a state senator in South Carolina who said that he's hearing more from his constituents now about this bill than he did a couple years ago when we went through this whole circus before. And, I do think in South Carolina, this is going to continue to get national news. It's going to continue to be an issue that is top of mind for especially female voters in November 2026. And I plan to talk about it often on the campaign trail. But, you mentioned RFK Jr. and this ridiculous,
Autism.
the autism stuff. Like,
why is he obsessed with autism? I'm convinced. I'm starting to think he might not even know what autism is.
I mean, honestly, you're probably right. He, he had this long career of maligning vaccines, which we know are safe and effective means to, preventable infectious diseases in children. We all thought it was going to be vaccines. Honestly, they saw polling that said the majority of Americans want them to stop attacking routine childhood immunizations. So they quickly pivoted to a word that Donald Trump doesn't know how to pronounce, which is acetaminophen. And then, the last thing I saw, which was that, circumcision in newborn baby boys, because they often get a dose of Tylenol afterwards. Now that's related to autism. Like, these men don't know how the scientific method works. They don't understand basic statistical principles. I know they don't know what a p-value is, and they're just making stuff up. And it's so frustrating because while they're doing that, they're, firing a third of the workforce at the CDC. They're, diverting NIH research funds from the serious scientists who are actually making progress on identifying the multifactorial causes of autism, diverting resources from studying, devastating diseases like Parkinson's and Alzheimer's, all for this political theater masquerading as science. And it's him being appointed to lead HHS was the straw that broke the camel's back for me to get in this race, because I never thought I'd see a day where a grifter conspiracy theorist would be leading our nation's healthcare system.
Well, that is something that I can say amen to, because I actually was working at the CDC during the first administration. I was working in the Division of Violence Prevention, which specifically is responsible for sexual violence prevention. And I was like, we just, appointed, at that point, no one was calling him this, but I knew. I was like, we just appointed a pedophile perpetrator as our president, and now I work for that president in the Division of Sexual Violence Prevention. Like, this does not compute. And naturally, our budget got slashed, right? Like, state health departments lost $45 million that year, which crippled any sexual violence education prevention programs they were doing. And that was actually why I was like, I need to get out, because I'm not seeing impact here and I'm seeing something else. So I can relate to that sentiment of yours very much. But I just wanted to express a little bit of gratitude to you, because the thing that you just said is you took yourself out of the physician perspective and really looked at it how this is affecting our public health, right? And I think that as a public health professional myself, who talks about this a lot online and who talks about this on our platform, I think people often lose the public part of public health. This is the reason why that every single person in this industry, every legitimate healthcare professional, every legitimate physician is raising alarm bells right now, is because this is going to affect everybody, right? And like you said, the people in charge, Lindsey Graham, RFK Jr., Donald Trump, they're not only not qualified, but they don't seem to have any interest in even lending themselves to qualified voices. So we need to make sure that those qualified voices are being installed in powerful positions by electing the right folks into Congress. And so I would love to close by asking you that if you did win the race in South Carolina, what would you say would be your top 2 priorities when you make it for your first year?
When I win, when I get to DC in January 2027, my first priority is going to be, we're going to have a lot of rebuilding to do. Who knows what we're going to be walking into? But if I want to talk about what I will fight for and spend my time advocating for, the first thing is passing a permanent, fully refundable, expanded child tax credit, because it is a very simple policy solution that would relieve so much suffering amongst America's poor children and families. It would help families who are struggling to make ends meet when it was an effect during COVID. It was incredibly effective at lifting millions of American children and families out of poverty. And that should be something that is relatively easy to get broad bipartisan support for. So that is my policy priority number one. Number two, so, I got my start as a gun violence prevention advocate. I will wake up every day and fight for that issue, starting with expanded universal background checks. But I do think, we have some really bread and butter problems in this country. And so because of these devastating cuts to Medicaid, we're going to have to rebuild the Medicaid system. And the Pollyanna in me, the glass half full person in me, sees this as a potential opportunity because of the destruction they're doing to this program that is truly the backbone of children's healthcare in America. We may have the opportunity to build back a program that's better, that's easier to navigate, that's more accessible, that provides higher quality, more affordable healthcare to more American children. I often talk on the trail about how amazing it would be if, just like we have Medicare for Americans 65 and older, what if we had Medikids for all American children under the age of 18? Because investing in preventative healthcare and children's healthcare costs pennies on the dollar to investing in seniors' healthcare. And if we invest in America's children's healthcare before they're in the workforce, we will have a healthier workforce and a healthier retired population. And I believe that's something that we could start talking about. And once we get through this really dark era in American politics, because of the destruction they're doing to our healthcare system, we need to see it as an opportunity to build back something better on the other end of this.
Yeah, it's almost like preventative care saves money and lives.
Almost like that, isn't it?
Who would have thought, right? That's what the data's been telling us for decades. Annie, thank you so much. It was a pleasure getting to know you, and we're going to be thrilled to follow your campaign and continue to amplify you.
Well, thank you so much for having me. And if folks are listening and they want to hear more about me, learn more about me, they can follow me on social media, Annie Andrews MD on most platforms. And then my campaign website is drannieandrews.com. And I really appreciate using your platform to talk to me and would love to talk more about what's happening in the South Carolina State House.
Thanks for tuning in to this episode of Women in America. If you enjoyed it, share it with your network and follow us on social media at women_in America. See you next week.